Why am I watching this video? You are watching this video because you were referred to our program after a discussion with your family doctor on the need for screening for lung cancer. However, we understand that deciding whether or not to get screened is a complex decision. Lung cancer is a potentially life-threatening disease. Even just the word cancer alone may raise concerns, fear, and feelings of anxiety. This is completely normal. We have created a short educational video that will help you better understand the process of screening for lung cancer and its potential benefits and harms. The objective of this video is to give you the information you need to address the most common questions and concerns. Why is there a need to screen for lung cancer? First of all, let us talk about lung cancer. Lung cancer is a disease where a group of cells of the lung grow in an abnormal way. This can become a mass or tumor. It is the #1 cause of cancer death in Canada for both men and women. In fact, more women die of lung cancer than from breast cancer. On average, every day, 78 Canadians are diagnosed with lung cancer and 58 Canadians die from lung cancer. For that reason, we are using a program to calculate your personal risk of developing lung cancer, which takes into consideration information such as your age and gender, your ethnicity, and your smoking history. Based on your own personal risk, you might want to get screened or not. It is important to understand that not everyone who can be screened wants to be screened. Once you understand the harms and benefits of screening for lung cancer, you may want to talk again with your doctor, and that's okay. We also invite you to discuss any questions and concerns with your doctor and/or your nurse navigator. What is involved in screening? By screening you for lung cancer, we are trying to find very small lung cancers or spots that may not be causing you any symptoms. This way, we can catch small lung cancers early and remove them before they cause any health problems. The screening procedure is safe, quick, and painless. When you arrive, you will lie on a table with your arms extended above your head. The table will then be moved through a donut-shaped apparatus to obtain the CT scan, which uses X-rays and a computer to visualize your lungs in 3D. Though the scanner will cover your entire body for a short period of time, both ends of the machine are completely open for you to see and hear outside of the machine. We use a low-dose CT scan, which requires no fasting, no dyes, no injections, and nothing to swallow by mouth. The scan takes less than a minute to complete, and from start to finish, the entire appointment takes approximately 10 to 15 minutes. You will be able to book your CT scan appointment online through our website. What are the benefits of screening? The goal of screening is to potentially save you from dying of lung cancer. We determined that your lung cancer risk is high enough that you would benefit from screening. We think by screening you with a low-dose CT scan, we can potentially find lung cancer earlier than if you were not screened. When we diagnose lung cancer earlier, it is often easier to treat and cure. Finding cancer early generally means that there are more treatment options available and more chances of survival. It is important to know that not everyone's risk of having lung cancer is the same. What are the harms of screening? You may have a false alarm. Screening works by finding lung nodules or a spot in the lung, some of which are cancer. However, the vast majority of nodules or spots detected on screening are not cancer. These false alarms have the potential to cause anxiety. However, understanding that the vast majority of lung nodules or spots found on CT screening do not represent cancer helps most patients avoid significant anxiety while they wait for follow-up testing. Another potential harm is that you may need to wait. Some people will have to wait for 3 to 6 months to see if a small spot grows. In other cases, further testing is required. This can include an invasive procedure such as a biopsy. These tests are risky and can cause harm in people who end up not having cancer. Invasive procedures can result in complications such as bleeding and infections, a collapsed lung, or a hospital stay, although this is rare. There are times when screening will find a nodule that is cancer, but that cancer was never going to cause problems. 1 out of 5 lung cancers detected by screening grow very slowly and will not cause problems during your lifetime. But it is often hard to wait and see if this is the kind of cancer you have. In many cases, finding a nodule can lead to treatments such as surgery, chemotherapy, and radiation, which are unnecessary and considered overtreatment. Overtreatment can cause side effects that make you feel sick with no benefit. What balance do you place on benefit, harms, and uncertainty? You have been provided information on the benefits and risks of screening. Based on your values, you can decide whether you would like to get screened or not. If you value the benefits more than the harms, then you should be screened. Remember that not everyone is the same. Not everyone will want to be screened. This is a personal decision, and we would like for you to take the time to think about it and discuss it with your doctor and/or your nurse navigator. No matter what you end up deciding, we hope that this video has helped you better understand what lung cancer screening is and why we are offering this to patients. Do not forget, stopping smoking is the most important way to protect yourself from getting lung cancer. If you have any questions, you can discuss this with your doctor. You will also meet our team to discuss the benefits and risks for your specific case before your screening starts. Thank you for taking the time to watch this video, and we hope to see you soon.